lower eyelid surgery 1 year ago, and I have these suture marks, train track scars, under my eye. Is there any procedure or cream I can use to get rid of these? I was thinking a chemical peel, but I was told that it is only very superficial. I was also told laser, but I'm afraid it would retract my eyes even more from the tightening. I also have ectropion and retraction too. What would help these scars and what should I stay away from? Also, what caused this to happen? Thank you.
Thank you for your question. You submitted a photo where you clearly demonstrate the suture marks from under your eyelid, and that being your primary concern, and that at the end of your question you also mentioned that you have eyelid ectropy and retraction. So I'm going to first address the first question about the suture marks. Those suture marks are, of course, the result of after having your lower eyelid blepharoplasty done from the outside, where an incision was made and skin was overlapped. Now, whether it was overlapped or whether there was a skin pinch is probably irrelevant at this point. It just stitches were placed and you develop these marks. Now, when someone has adequate skin, my approach typically would be to just excise the skin that has the marks, or at least much of it as possible. Now, you can sometimes improve this area with laser, but because the skin is so thin, that's a very tricky thing to consider. Given that you also have retraction and ectropion, in my practice, I deal with eyelid retraction ectropion a lot from people who come to me from all over the world who have this problem after cosmetic eyelid surgery, and very often they've had one or two, maybe more revisions before we see them. Now you're dealing with an issue where there is multiple problems in terms of tissue availability. That means if your eyelid is rotated out, then it could be a skin shortage, so you need more skin. If it's retracted, then the middle layer of your skin needs to have some vertical height. So you might need much more than just dealing with these suture marks. But this is dependent a lot on your perception of your cosmetic outcome, as well as how aggressively you want to deal with the functional aspect. You know, in ophthalmology, having eyelids that function well is critical for eye health. We know this. So it's surprising to me that you're not as concerned, or at least you didn't mention in your question, about symptoms related to tearing or dry eye. So I think that your concern about the marks is, of course, important, but I think that in the big picture, the position of your eyelid as it relates to the health of your eye is a more significant thing that can be that needs to be addressed. So my suggestion is to consider a strategy to help address the eyelid retraction and ectropion. So I would recommend visiting probably most qualified is an oculofacial plastic surgeon with a lot of experience in this area, particularly in the cosmetic area. There are some who focus a lot more on cosmetic and some who focus more on just general medical issues. And I think that, from experience, my practice being 99.9% cosmetic, I'm able to offer a different perspective based on experience. So I would suggest you find an oculofacial plastic surgeon who you're comfortable with and discuss this matter and what you'd like to do, and then make your decision based on the options available. So I hope that was helpful, and thank you for your question.